Hello, my name is Brandon Blanford, and I am currently a nurse at the University of Kentucky Hospital on the cardiovascular progressive floor. We take care of the patients that have had open heart surgery, have congestive heart failure, are lung transplants, heart transplants, or have been diagnosed with furthering heart problems. We also have left ventricular assist device patients. When deciding where to complete my BSN, I chose to go to the CVICU where I could utilize my skills to improve my education on the current patient population in which I have chose to participate for these clinicals. Now let's take a look at what I've learned in the CVICU. So we'll go over a brief description of the CVICU at the University of Kentucky, the patient population, and the nurse to patient ratio. After completing my clinicals in the CVICU, I have learned more information about what exactly happens over there and what their nurses can do in comparison to the nurses in the CV progressive side in which I currently work. The CVICU takes care of all the patients that have any cardiovascular problems in which we receive, and they care for them when they have higher acuity, such as being on an epinephrine or a norepinephrine drip, or they decline furthering, or the furthering decline, or they have machines that are doing the jobs of that the organs are supposed to do, such as ECMO or CRRT. When caring for these patients with such a high acuity, the nurse to patient ratio is either a 1-to-1 or a 1 nurse to 2 patients. In the ICU, they have many more resources than we do here in the CVICU, in the CV progressive. This is another reason why I chose to come to the CVICU. Next, I will discuss my learning outcomes for my capstone. So the goal from the evidence-based practice is to educate the cardiovascular progressive nurses through oral presentation on 3 learning objectives and allow them to ask questions if they are unsure on something. So my learning objectives are: identify the importance of milrinone, how it is initiated, and how it is titrated to prevent furthering heart failure. Identify the importance of the initiation of a heparin drip rather than an anticoagulant in the patient population of CV progressive. And then last, explain the process of extracorporeal membrane oxygenation, or called ECMO, in the CVICU. I chose to focus on these learning objectives because many times in the CV progressive, the nurses are not properly educated on why exactly milrinone is started in a heart failure patient, or why heparin is used rather than an oral anticoagulant. And majority of the nurses are ignorant to what ECMO is and what it actually does. By educating them on ECMO, it allows them to be up to date on information as they continue their career in the cardiovascular service line. So next we will compare my experience in the CVICU compared to the literature in which we have went over this last semester in the BSN Capstone class. So with this, the teamwork in nursing, we in the CVICU, it calls for all the nurses to work together due to their high acuity of their patients, and multiple patients can be declining at the same time and needing CPR. So one of the things that it all relates back to is safety. Interdisciplinary collaboration. An example that I've had over there is a patient was doing abdominal breathing, but it wasn't related to his breathing, rather than it was related to pain. So the nurse, myself, and the resident were unsure of exactly what was causing it, so we had to call in the fellow, which shows the interdisciplinary collaboration. Another example is other nurses coming in and taking care of one of your patients while your other one has declined, which results back to safety. And then transitioning care, we see that a lot. A lot of the CVICU patients transition out to the CV progressive or to the sister units. to continue their care whenever they require less of a higher acuity of care. So to discuss my learning objective 1, which is to identify the importance of milrinone, how it is initiated, and how it will be titrated to prevent furthering heart failure. And this is a picture of what milrinone actually looks like. So milrinone is used for a short treatment of heart failure. It works by making your heart beat stronger by relaxing certain blood vessels so that the amount of blood that is pumped out of the heart is increased. This effect may help the symptoms of heart failure, such as shortness of breath or tiredness. When starting the medication, the doctors do the medication based off of like 0.25 micrograms per kilogram per minute. They will increase or decrease the medication based on the patient's weight. And although this medication is supposed to be short-term medication, many of the patients are consistently on it. Next, I will discuss the importance of heparin rather than an oral anticoagulant. So heparin is an anticoagulant that is used in patients who are going to be having surgery, but also wanted to clarify that while we use IV anticoagulants such as heparin rather than warfarin in our LVAD patients. As the chart shows, heparin has a shorter duration, which is 4 to 6 hours, so it's easily titrated to get your PT, the clotting factors, right where you want it before a patient goes into surgery. And then warfarin, it's a longer duration, so it's 3 to 6 days, and it's hard to titrate that and get that out of the system. And also, like the kidneys, anything like that can prevent the warfarin from being excreted out of the body. So the onset for heparin is immediate, so it's that quick acting, such as preventing blood clots or something like that. And then warfarin is delayed, so it takes a little bit longer. And then as you can see also, just kind of like the mechanism of it and the route and then the chemistry exactly of what heparin does. I was able to educate the nurses on this, and some of them had questions about it. So the next thing that we'll discuss is the different types of ECMO. Learning objective 3, explain the process of extracorporeal membrane oxygen cannulation, which is ECMO, and the CVICU. So the goals of ECMO are to improve tissue O2 delivery, remove CO2, allow normal aerobic metabolism, and provide lung rest. So VA ECMO, or veno-arterial ECMO, supports both the heart and the lungs. The surgeon will place 2 cannula, one in a large vein and one in a large artery, so that the blood can be taken out of the vein and returned into the artery. VA ECMO is most like the heart and lung machine used during open heart surgeries. The indications for VA ECMO are post-cardiac surgery, cardiogenic shock, myocarditis, sepsis, heart and lung transplant, post-op, and bridge to transplant. The other type is VV, or veno-venous. Veno-venous supports the lung function primarily. The surgeon will place the cannula in a large vein only, usually in the neck. Based on the patient's age and condition, the surgeon may choose to place one special cannula in the single vein or to place 2 cannula in 2 different veins. The special cannula in one vein has 2 channels side by side, allowing for the ECMO pump to draw blood out through one channel and back through the other, while it uses the native cardiac output, which is the heart, to carry the oxygenated blood into systemic circulation. Some of the indications for VV ECMO are ARDS, severe pneumonia, smoke inhalation, and primary obstruction, along with a few more. I wanted to educate the nurses in the CV progressive floor about ECMO because many of them are not sure of what exactly ECMO is for, and we often receive the patients from the ICU who have been cannulated and decannulated for one of the previously stated indications for AV or VA or VV ECMO. My favorite part about completing my capstone in the CVICU was that I was able to learn furthering information about the patients in which we care for in the CV progressive. But when they are at a higher acuity level, such as the CVICU, they have more resources, such as I've already stated. It was interesting to be able to educate on the learning objectives and be able to educate them in the CV progressive nurses. I hope to take this information in which I have learned in my capstone in the CVICU on in my nursing career. Thank you.